We are going to do tracheostomy suctioning. So our patient here, he is trached and he needs suctioning because I know this because I've listened to his chest. He has bronchi. Maybe his O2 sats are low. Maybe he's just scheduled for suctioning. He possibly could be coughing and I just see he has some secretions coming out, or maybe he's pointing and he wants to be suctioned. So I'm going to suction Mr. Smith here. I've washed my hands already and we're going to get started. So this is your suction catheter kit. What I'm going to do before I start to suction him is I'm going to do everything I need to before I get sterile. So I can get a regular towel and put it across Mr. Smith's chest just so there's no mess. I need some saline that I can go ahead and loosen the top on so I can, or take the top off of. Of course, if it's been used before, we may want to lip it. If not, it should be fine. I'm going to put my oxygen at 100%, which is 10 to 15 liters, and that is going to blow up my ambu bag here. And the suction on regular, the suction's kind of not working right now, but you flip the gray thing over to regular on the top and you turn the dial so the arrow is at 80 to 120. And then we've done everything we need to Mr. Smith before we get sterile. We can put him in semi-Fowler's position. If he was unconscious, we could turn him toward us just so that it is of ease of suctioning, for ease of suctioning. And you want to, of course, if you're right-handed, you want to be on the right-hand side of the bed. If you're left-handed, you want to be the other side, or whatever is most comfortable for you. So at this point, I'm going to go ahead and open up my suction kit. All the suction kits are a bit different. You have a, let's see if this one has one. A small box here that you want to grab the bottom of and open it up by squeezing it. What you don't want to do is stick your finger down the inside of the box. That should stay sterile. So if it won't stay open, then you can pull the bottom flat or just pour some saline in it. That should keep it open enough. So there we go. Then I'm going to get sterile. The same sterile procedure, putting on gloves that you do in general. And these gloves are kind of bad. So in check-offs, for check-offs, if you want to get another pair and put in there, that's fine. Okay, so at this point, both of my hands are sterile. And you can grab your suction catheter. You are going to keep your suction catheter in your dominant hand. What I like to do is I just sort of put the end of it between my thumb and first finger here, make the number 4, and I wrap it over the top because you want to be able to hold this pretty firmly because you're going to have to put it into the suction catheter, suction tubing. So get a grip on it pretty firmly. Now I'm going to contaminate this left hand here by grabbing the suction tubing and connecting it. And I'm going to test my suction. When you test your suction, the suction is on when your finger is covering the hole and it is off when your finger is off the hole. But as you can see now, I've contaminated the white part of this, so when I wrap it back up every time, I have to stay away from the white part with my sterile hand. So I'm going to test my suction with my finger over the hole, and I'm lubricating it at the same time. It's working. So I'm going to wrap it back up, now staying away from the white part. What I like to do is just kind of hold it away from me so I can be sure that doesn't touch anything. Now I'm going to move Mr. Smith's oxygen device, his tracheostomy collar here, just over to the side to get it out of the way. And I'm going to hyper-oxygenate him with 2 breaths. I'm going to connect him, and I'm going to give him 1, 2 to 3 breaths just to hyper-oxygenate him because we're going to be sucking all of his oxygen out here in just 1 second. Going to unravel, and I'm going to suction him. You should hold your suction catheter taut, straight up and down, because if it's like this or like this, you're going to contaminate it on something. So if you hold it straight up and down, I'm going to go down his tracheostomy with the suction off until I meet resistance. When I meet resistance, I'm going to pull back about another centimeter, and then I'm going to suction him on, off, on, off, on, off, as I'm kind of pulling the suction catheter out through my fingers, on, off, on, off, on, off, keeping my fingers low, no more than 10 to 15 seconds. Wrap it back up, staying away from the white. Going to give him his oxygen back and let him rest for a minute or so. Look at his O2 sat, see how he's breathing, seeing if he tolerated it. If he looks like he needs some more breaths, you can give him the ambu bag back, but you don't need to in between passes. Now I'm going to suction him again. So I'm going to unravel, hold it straight up and down, go down until I meet resistance. When I meet resistance, I'm going to pull back about 1 centimeter, and then on, off, as I pull the catheter through my hands, keeping it low, on, off, no more than 10 to 15 seconds. Wrap it back up. Put his oxygen back on him. You can suction him no more than 3 times, so you can go down once more if you needed to. At this point, you can suction his nose and his mouth out. I would do the mouth first and then the nose. The mouth and nose are not sterile, so you could just wipe off the outside of the catheter with a towel if it was yucky, or you could clean off the inside with the saline, and then I could suction his mouth if I needed to, and I could suction his nose. If you do suction his mouth and nose, you cannot go back down his trach again. You'd have to get a new kit. I would document, you can actually just now discard the suction catheter by pulling your glove off over the top of it, throw it in the garbage can. I would document color, amount, consistency, anything related to his respiratory status, lung sounds, respiratory rate, pulse oximeter, O2 sat. I would call the physician if the sputum looked any different than it had been, if it was green, foul smelling, just a different color, especially if my patient had a fever also, and if the sputum was grossly bloody. It's normal to have some streak blood in there sometimes just because of the trauma of suction, especially because some people have a tendency to set the suction too high. But if it is any more blood than normal blood, you should call the physician also. And that is tracheostomy suctioning.